Okay, next up we have Dr. Zukowski, who is a PhD trained occupational therapist with joint appointments at Kennedy Krieger Institute and at Johns Hopkins. She works in the motion analysis lab and specializes in gait dysfunction, which is what she will be talking about with us today.
This is my pointer?
Yes, so this points and that advances.
Okay. All right, everybody, hello. I feel like I got a little shafted because we're right before lunch, and I know what I'm like right before lunch, so I thought of that as I planned my talk. So everything I'm going to talk to you about is very practical, and the hope is that you'll get something that you can take from this and maybe use. And I'm happy to take questions throughout. Let me tell you a little bit about myself. So I'm a trained occupational therapist, and I have a PhD, and what I do now is I have a laboratory where I study walking and balance, and I'm trying to better understand how the symptoms that you feel, weakness, sensation, sensory loss, loss of balance, falls, how all of those things relate to the pathology of your condition. And so I'm not going to show you data today. I'm just going to talk to you practically about how we look at walking so that you can understand what your therapist may be looking for, what your physicians might be looking for, and then give you some guidelines on things that maybe you can try to do to address those issues. So with that, I'll move on. So walking is really complicated. It's complicated because you have to use a lot of muscles. You need neural input from the spinal cord, and you need input from the brain to make any modifications to your walking. So if you want to step over something, around something, then you need the input from your brain. Changes in the central nervous system for lots of different reasons will change your walking. Transverse myelitis is one of those. So what do people look at with their walking? So we have this has been established for a long time, so this is definitely not new, but I'm hoping it might give you all some idea of the sort of characteristics we're interested in. So there are two phases of gait. There's stance and swing. It's really practical, right? So when this foot hits the ground, that's the start of stance on that side. So heel strike, the foot's flat. This is called mid stance because you're on that limb alone. The other leg is up, raised up, and then you push off with that same foot. So that's your stance phase. Now with that same right leg, now you're gonna lift it up after you push off. That's acceleration. Then you're going to have mid swing and then deceleration right before you put the heel down again. So that's your swing phase. Now it's important that we break it down because there are reasons why you would have issues with walking during the stance phase or during the swing phase, and they're very different. One is related to how well you can weight bear, for example, and one is related to how well you can control that leg while it's swinging through the air, right? Another thing that we look at commonly is how big of a step you take. So taking small steps is fine, but that changes the dynamics of how you're walking. And so that's important because in order to get across the street in a reasonable amount of time, you have to be able to get a distance within a certain period, right? So for practical reasons, you want to maintain some of your walking speed. So step length is one feature. How wide your feet are as you walk is important. So as walking becomes more difficult, many people take a wider stance. That makes it so the balance component isn't quite so high, right? It keeps your balance. If you put your feet closer together, you're more wobbly and you may fall. So knowing this consciously, you can actually change the width of your walking yourself, and that might make it so that you don't fall as much. There's also your center of mass is kind of sort of right here in your sort of lower part of your stomach. And that is what you want to maintain. You don't want to lean too far one way because you'll fall. You don't even want to lean too far forward because you'll fall. You want to be able to control that center of mass. And so we know that as you walk forward, the center of mass goes up and down about 2 inches with every step. So you need to be able to have the strength to control that change in your center of mass. There's also lateral shifting. So as you shift your weight to the right side on this figure, in order to lift this leg up, you have to be able to control your weight shift and not go too far. But if you don't go far enough, then you can't lift this other foot up because you have to take all the weight off of it, right? So you have to be able to control your shifting. Your pelvis is this part that's attached to your hips. It rotates as you walk. So as you take a step forward, this is kind of a bird's eye view. As you take a step forward, it actually rotates like 40 degrees. forward. And you need to be able to control that pelvic rotation. And sometimes that's a really big feature that you can't control very well. And so the therapist will look at that and be able to say, okay, which muscles do we need stronger to allow you to control that rotation? There's also something called a Trendelenburg test. And all this is, you know, physicians do this all the time. You're in the office and they're like, okay, can you stand? Okay, now I want you to lift one foot. And what they're looking for in part is how well you can maintain your pelvis on a horizontal there. Does it raise up when you lift up one leg, or does it drop down? Now, we want it to be so that it doesn't move very much at all. So a slight upward raising is okay. A drop in your pelvis when that foot raises up indicates that this leg isn't strong enough to hold up the other leg. And so, because when you're standing on one foot, this side of your body does all of the work. And this side of your body is heavy. So if you can't do that, this test will give us an idea of which muscles to target in therapy. Now, I have videos, but as it goes, they don't work right now. So I'm going to just tell you that this was just to show you what a healthy person walking would look like. And I'm going to move on and talk about two common gait problems. One associated with weakness. Another is associated with weakness but gives you more instability. So weak ankle dorsiflexor muscles. So your dorsiflexor muscle is this muscle right here in black. And its main job is to lift the foot up when you need to bring your foot forward during swing. And so if you have the problem where your foot kind of scuffs or drags on the ground, especially maybe when you've been walking a longer distance, then we know that muscle is weak. Another common problem with weakness in that muscle is that now you know that's the problem, so you consciously correct for it, right? So now you lift that foot higher so that you can clear the floor and you don't trip. Another common characteristic is that when that foot comes down for foot flat during stance phase, it kind of bangs down. It's not controlled. You can't just roll from heel to toe. So these are all things that we're thinking about as we're watching you walk. Another important muscle is your gluteus medius. So it's kind of your butt muscle. There's a couple of them layered there. And the gluteus medius is really important for allowing you to have this stance phase on one leg and controlling how far you rotate over. And if you have a weak gluteus medius, then what you do is you lean over with your trunk and you can't control how far you weight shift. There's another muscle sort of on top of the gluteus medius, but in the same area, called the gluteus maximus. And when that one's weak, what you see is people often throw their pelvis forward when they walk. So instead of walking straight like this, they kind of push their pelvis out and bring the foot forward. So that characteristic is because this muscle back here is very weak. And this allows you to walk still, but it changes the characteristics of how you walk. Again, I had a video that was very good and descriptive for that. I'm sorry. Now, another important muscle for walking is your quadriceps. So the muscles that are all in black here, it's sort of best known to be kind of this upper leg muscle. There's multiple muscles, and they allow you to control your knee. When this group of muscles gets weak, you can't control your knee, and so you end up what we call hyperextending your knee. So you can't control your knee when you go into stance, and so it ends up extending too far and slamming back. And this is very bad for the knee joint, as you would imagine, but we know that it's due to weakness to this muscle. So one goal would be, can we strengthen that muscle? Another good video that I can't share with you, sorry. So how do you treat this, right? So the most obvious thing is, well, you need to exercise it, as Dr. Becker mentioned. So exercise gives you the opportunity to have some control over your body. It's not a medication that you can take quickly. It's something you have to really commit to. And it helps you to compensate for some problems. So if you can't strengthen every muscle, can you strengthen other muscles that allow you to compensate for the weak muscle that you can't make as big of an impact on? When we talk about weakness, it's not simply the weakness that occurs because of a condition that you have. That's what we call primary weakness, and that may require you to compensate for. But there's this secondary weakness that I feel like gets little attention, and so that's the weakness that is usually due to disuse. So you get a condition, it becomes harder to walk, you get more tired easily, and then then you walk even less, and then you get more tired even easier. So now you're just very, very deconditioned because everything seems very overwhelming. And so as Dr. Becker said, what you want to do is try to exercise at a level that fits where you're at right now. And this is part of what a good therapist can do for you. They can help you find that threshold and help you progress from that. But be very aware that these two kinds of weaknesses are very different. You may be able to affect the primary weakness, but you always can affect the secondary weakness in some way. Okay, there are other treatment options. So I just went through and made a list off the top of my head of things that I thought you all should be aware of. Some of these things I'm guessing you know, and I'm hoping that some of these things might be something that you'll learn from too. They're not all equally as successful, but the problem with rehab right now is we don't know exactly what dose you need. We don't even know exactly what kind of treatment you need. And this is a very difficult process. So you need your therapist to be creative, to want to be invested in your issues. And that's a really big part of the successful rehabilitation, is having good communication, not only with your physician, but with your therapist, because they're your movement experts, right? So one, neuromuscular electrical stimulation. So Dr. Becker talked about this. I'm not going to discuss the mechanism, which is what Dr. Becker really went through. I want to talk about the practical risks and benefits that you're going to experience. I'm going to set up the next few slides the same way. So there's going to be a green box, which gives you an idea of where you can find this. And then I'm going to talk about things that I thought of as risks and benefits, and they may be, there might be others you think of, and that's good. We could discuss that. And then at the bottom, I put, as a researcher, issues that I was interested in. So questions that I think are not answered, that you should know are not answered. So for electrical stimulation, it's very simple, right? You put a pad on the muscle that you want to stimulate. This little box is connected to this pad, and you emit little electrical pulses. And the idea is, if you can't drive the muscle from your brain or spinal cord, can you drive the muscle from the outside in? And you can. This has been out for many, many years. The risks are that the initial equipment cost is high, though now therapy in many rehab centers, you can rent these, so your therapist can show you how to use it and let you take it home. Skin integrity. So, it's electrical pulses. So if you have too much, then you burn the skin. But that's, again, where your therapist can give you guidelines. The benefits is that you can directly strengthen that muscle where the pad is. And so that has some really important improvements for how well circulation is to that area. It's very portable, so you can take it with you when you travel. So it's something that you definitely could use. What we don't know specifically is that our muscles strengthened by this type of stim as effective as strengthening them by regular exercise, right? So the stimulation is trying to stimulate you from the outside in. And can you, in combination, does that give you a greater advantage to strengthening muscles? A different kind of idea is this idea of functional electrical stimulation. So the word functional appears the important word. So instead of just stimulating a muscle and getting that muscle to contract, can you get that muscle to contract when you need it? So there are lots of devices out here. I don't work for this company, so there are others. But I want you to know about it, and this picture sort of gives you an idea. Can you use a stimulator on a particular muscle, this tibialis anterior, to allow you to lift your foot when you need to during walking? So it has limited but growing access. The potential risks are mostly that it's very costly. So a device like this that is timed to your walking very nicely, so it's not just a pulse that goes at a certain cadence. This kind of device is around $6,000 for one leg. So keep that in mind. If the cost is high, insurance company theoretically can cover it. I've only known about a handful of people that have had it covered, but it's possible. And there are other companies that have similar devices, not just Bioness. There's a WalkAid, and there's one other that I can't think of right now too. It's very, again, you still have the skin integrity risk. It's time intensive, so you have to use it for it to work. And when you take it off, it might not work. There's a question in the back, yes? Yes, you know what I just thought? It's called the odd stock. That's right, and it's out of Britain, and it's around $200. That's what I for both legs. Okay, so maybe you have more accurate information than I do. They've definitely talked about this. Sorry, that's loud. They've talked about this at other. I've seen this put on people with different conditions, and it has been equally as effective. It's not quite as pretty, which is what you're paying for with the high cost. Is that a good? Yeah. So the benefits are you can improve the muscle bulk, which means you don't have atrophy. It's definitely, as you strengthen a muscle, the muscle pulls on the bone, so that improves your bone density. And so for women, this is a really important component. Again, circulation to this area is really important, and it can improve motor control. So it allows you to use the muscle at the right time, not just increasing how strong it is. So the question is this as applicable in transverse myelitis as it has been in spinal cord injury? And then the idea would be it should be different, right? Because your damage is different to the spinal cord in TM than in a traditional traumatic spinal cord injury. Yes?
Is it possible or okay for one to go to sleep wearing these pieces of equipment kind of going 24/7?
Yeah, it's a good question. So the question is it possible to sleep with these devices so that you could be getting exercise as you sleep? So in theory, it's a good idea, but here are the problems. You can feel it when it goes on. So I don't think you'd be able to sleep very well. If you wouldn't use a functional electrical stimulator, you'd use the one I showed before, the neuromuscular electrical stimulator. But you do get a sensation that I think would be uncomfortable enough that might limit your sleeping. The other thing is you want to figure out what dose you can use that gives you benefit, so that, as Dr. Becker mentioned, you can go out and go all out with exercise when you leave here because you're enthusiastic. But the cost is that you're gonna go past that threshold of where you are potentially, and then that doesn't help you. It doesn't cause long-term benefits in general, but it's something that you'd want to figure out before you just put on an electrical stimulator and have it on all the time.
They typically have a time. They'll time it.
Right. So the comment was there's typically a timer on it, so it won't stay on permanently, but you could adjust the timer. So that if you wanted to use it longer, you can. But good point. It's not generally done that way. The standard of care is really to have periods of time where you use it. Yes.
Can that potentially stimulate nerve flares? Can that trigger them?
What do you mean by nerve flare? Pain?
Yes.
So, right, so this is important. This is why you don't want to go out and buy one of these online and just use it on yourself. You want to do this with a professional that understands TM, understands you, and then you can try it. So you can overly use it, so it could cause you pain. It could cause secondary effects, because all it's doing is sending an electrical pulse to the muscle or to the nerve that goes to that muscle. That's it. It's basic. So everything else is not going to be changed. Okay. Now there's something called taping. So this has been used, it's increasingly used, not only in neurologic populations, but you've probably seen it with people in the Olympics. All the volleyball players have the blue tape on their shoulder. So this is the same idea. But it's worked really effectively for some of our patients. So all it is it's tape that has some elasticity to it, and you put it on the skin over the muscle that you want to make a change to. It has been shown, the benefits have really been, you can see changes within a week because the skin is attached to the muscle. And so if you're pulling on the skin in a certain direction, it's also pulling on the muscle. So you need someone to really know how to apply it, but there's no electrical stimulation. You can't get hurt from it. You can learn how to apply it yourself. You can put this on and it stays on for 3 or 4 days, so it's waterproof. And it's also very easy to wear under clothing, right? So it's not as obvious for people. It has been shown to improve how well your muscles can relax. So people who have spasticity, this has been very helpful for. It can improve posture, because often postural changes are because you have weakness in one muscle and you're overly using another. So if you can relax the one you're overly using, you can encourage the other muscles to be used. And by far, it's easy application and very cheap. So The idea is it as effective on spastic muscles with TM as it is on people who have sports injuries, which is more commonly what it's used for. But I feel like you should know about it. These are things you can look up online and try to educate yourself a little bit on all the options you have. Treadmill training, nothing terribly new, but definitely it helps you increase your walking speed. It gives you a safe environment to try it in. It has cardiovascular benefits, so when walking becomes difficult, all of a sudden we're not able to raise our heart rate. You're never out of breath. And that has secondary effects on your lung capacity, which puts you at higher risk for things like pneumonia, right? So you want to be thinking about all these effects of not being able to exercise. Also, walking has nice benefits for bone density because you're weight bearing as you do it. So the risks are that you could fall, right? And that's a big risk. I've fallen on the treadmill. It's not pretty. If you can't keep up with the speed, then it's probably very frustrating. You can also overexert yourself, so do too much. And that's, again, where you have to be very careful that you're monitoring what you're doing. The other problem I have, and I don't know what, maybe it comes up next, but the question should be, does this really generalize to what you do on land, right? Because on a treadmill, there's a belt moving your legs back, and you just have to meet it by bringing the leg forward. So that's a lot of what we do in our lab, is really try to figure out all of these technical ways to improve your walking. Using a lot of technical equipment isn't very useful when you go home. How do we get it to generalize better? There's something called partial body weight support. So you want to be able to walk, but you can't hold your weight right now because you're so weak. So what we use, go wrong way. All right, so what we use is this device. It's on wheels, and it essentially gives you're put in kind of a harness system, and you can use whatever walking device you use. This man is using a walker, but you would walk with them. So a therapist would be with you, and this would allow you to use your legs for support. And it gives you that feeling of walking, which is also just really encouraging for many people. And it's useful. You can use this over ground, and you can use it on a treadmill. The risk is it's really bulky, as you can see, so this wouldn't be something you could do in your home very easily. And you really need someone who's skilled in how to use this appropriately. You don't want to fall on it. You don't want to end up somewhere that puts you at higher risk for falls. And again, here's my question. So does it carry over to walking on land? That's still a question. Am I being kicked off? Sorry, I have a couple more. I'll go quickly. And we want to eat. So aquatic therapy was brought up. This is really important as well. You need a specialized place to do it. That's often an issue. The costs, the risks are that it could be costly. It's not really it doesn't really give you this benefit of weight bearing, but sometimes that's even better because now you don't have the issue of weight bearing. It really depends on where you are on that spectrum, right? The benefits is that the water literally can hold you up. So as long as you're in a safe environment, you don't have this risk of falling. You can change your resistance. That's really appropriate for what you need. It's also often more fun, so people really enjoy it. And is it really more effective than doing exercises on land? I think that depends on the person. Hippotherapy, this is basically riding a horse. And so the idea is when you're riding a horse, you have to use your trunk muscles in a very distinct way. So it's a way of exercising your trunk muscles, again, without the risk of you're not being strong enough to hold up your trunk. So the benefits are very good for trunk postural stability. It allows you to stretch your muscles because as the horse moves, you're actually moving with it. And a lot of people talk about this emotional benefit, which goes back to what Dr. Kaplan mentioned. So this purposeful exercise, it gives you a feeling of you're doing more for yourself. You're interacting with something, so that might be more motivating for you. So then you feel better potentially when you're done with that therapy. The risks I've listed here, I'll kind of move forward faster so that I can finish and we can get to our food. So other issues, this will probably be brought up later this afternoon. So the idea of using botulinum toxin or Botox, it's a muscle relaxing medication. It's given intramuscularly in the muscle, so to certain muscles that are really, really tight and you've tried stretching and the stretching doesn't make a difference, this might be a direction you want to go. So there are risks. You can't really do this on large muscles as effectively. You have to go back for repeated injections. It's not a permanent change. But the benefits are you often have improved comfort, and you can use that part of your body more easily because that one muscle that's causing such difficulty is now changed. So alternative therapies, there are many more than this, but I thought, so massage, I feel has some benefits. So it promotes how well you can relax. It's very important for reducing stress and depression. It's been really hard to show show in our Western medicine culture the concrete benefits of it. So that's sort of the limitation. It's not uniformly regulated, so your massage therapist might have different training than the next person, so you want to know that going in. Another type of alternative therapy is acupuncture. Again, has been shown in many studies to have relief of pain, muscle spasms, or bladder control, but again, not in a very controlled setting. So we don't know what the dose is. We don't know exactly where the acupuncture needs to be to make it effective. But many cultures use this as their regular rehabilitation. All right. Last, I wanted to give you sort of ways to find a physical therapist. So you need a movement expert on top of your medical expert. And so specialty in neurology is what you really want to look for. Just like you would find a neurologist who has a specialty in neurology, you want to find that in your PT. I feel like, and your OT. So I've talked really specifically about walking, which isn't specific to occupational therapy, but there's a place for occupational therapy too, in getting you to be functional in what you're doing. That's just not the focus of what I was asked to talk about today. So finding this therapist is really, really critical. I can't tell you the number of people that come to me and say, I tried physical therapy, I tried rehab, and it just didn't work. They discharged me. So realize that there are lots of people trained in different ways, and we really need to be the educated consumer and know that you're looking for the therapist who has the enthusiasm and the resources to try things with you and be creative and make sure they communicate that with you. Often there are therapists at university centers that are more up to date on their on research. That might be helpful, but mostly it's good communication. All right, that's it. Thank you.
Okay, so we're actually just going to do 2 questions because I know there was some opportunity to ask questions during the talk. But I'm also going to let you know about an opportunity, since Kathy's up here. Dr. Levy is actually the PI for a study that Dr. Zukowski and Dr. Becker and Dr. Pardo are also involved in. And this fits nicely to talk about it right now since we're talking about gait dysfunction. It's some people in this audience have been involved or are currently involved in the study. It's using a medication called Ampera, and there's a write-up about it in your folders. And it's FDA approved in multiple sclerosis, and it's to help with specifically with gait dysfunction. And we're looking at its use in transverse myelitis patients. If you're interested, it's for patients who are functional in their walking such that they can walk, either assisted or unassisted, and walk a 25-foot timed walk in 5 seconds to 60 seconds. So there's a lot of room in terms of their ambulation capabilities, but we're set up in the hallway if you wanted to test your function and see what your function is and see if you'd be a candidate for the study. There's a lot more to know about the study, but that's just the quick and dirty of it. And you can talk to either Dr. Becker or Dr. Levy or Dr. Zukowski or Dr. Pardo or myself about it. And it's Hua is the study coordinator, and he's the one that's testing it if you wanted to see if you might be a candidate. But we're going to break for lunch now after these 2. Timed 25-foot walk. Sorry, I don't know what I said. But we're going to see if you have any couple questions for Dr. Zukowski. And so, do I have any hands? That's because you're all very hungry. And so,
Yeah.
What's the main factor to all this rehabilitation? How does pain factor into all this rehabilitation that one needs to go through?
So that's a very good question, right? Because the fibers that control pain are variable from person to person, right? So depending on where the damage is. And there's also the wear and tear of how you've used your body up to that point and from the point when you've gotten the TM. So the short answer is we don't really know. What we do in our studies is you monitor how pain changes. And what you do as an individual is monitor how your pain changes with any intervention, whether it's a medication or a physical rehabilitative intervention. So I'm sorry there's not a better answer, but I think the best thing we do is monitor it, and over time we'll be able to make better assessment. Sorry. Well, the drugs that eliminate pain overall will also make you very sleepy and give you cognitive changes, and they're addictive. So that's the side effect, right? So it's a cost-benefit ratio, right? The pain really probably limits many people's quality of life, and that's a problem. So you have to weigh that need with what the secondary effects of many of the pain medications that are really effective are.
And Dr. Newsom, one of the neurologists in the TM
that's
Center,
right.
is having a talk on
That's right.
pain.
Good.
this
That's right. So
afternoon.
that should be, yeah.
Just wanted to kind of add a little bit to what, when she was talking about how to find a physical therapist, the ones that focused on neurology, because I've been big on this for a long time, that when you call a facility and ask, do you have physical therapists that specialize in working with neurological patients? The first answer you're going to get is, we have both, the orthopedic and. When they say both, they mean no, that they don't have, that typically it's not they don't have one that specializes in neurology. And so you have to kind of keep pressing them to make sure that they're actually specialized in neurology.
That's a really good point.
Mostly not. They say both.
Or they say we treat everything. That's always a giver. Think about you don't do everything well. So you need to find the clinic that will say, well, we do have therapists that specialize in neurologic diagnoses. And then the ideal world, you'd say, can I talk with them? And then you'd say, I have TM. These are my issues. Are you interested? Right. Well, and if they haven't heard of it, but they do treat other conditions like multiple sclerosis and they're interested, they can be educated on what there's such limited information on what is specifically treated, what the specific rehab intervention is for TM, that not knowing about TM might not be something to cut them out for. They might be really good at trying other options, but you just want to be careful you're not being paired with like a orthopedic physical therapist or sports PT or just someone who wants to try the run-of-the-mill stuff. Is that a good? Yeah. Okay, fair enough.
So it is lunchtime.